Okay, Teresa. Thank you for having me.
Thank you for doing this, Felix.
I'm happy to do it. All right.
All right.
Monica, we got Sharon. Okay. So this is in honor of Teresa, who single-handedly launched AMD training
You're so
way back in 2018. And so many of the ripple effects originated from Teresa. You're looking at her right there. So she asked me to do a presentation on children. And so here we go. This is a picture of two actresses from the movies Hollywood's golden era, black and white era, okay? They didn't have a lot of makeup. They didn't have plastic surgery. They didn't have braces. You are as you are, or you were as you were, right? So what's the difference between these two faces? All right. I mean, it's obvious, right? But my point here is that we can control this outcome now, non-surgically, without scalpel, without knife, without even braces. All right. We have cracked the code to this thing called epigenetics. So how many of you are doctors and how many of you are non-doctors? Raise your hand if you're doctors. Okay. Raise your hand if you are patients, mothers, consumers. Okay. From best I can gather, it's about half and half. Great. Okay. So whether you're a doctor or a patient, I want you to just drop your white coat and doctor title and ask yourself, what do you buy from your doctors? Do you buy pretty smiles? Do you buy adrenaline filling? Do you buy night guards? Do you buy myofunctional therapy? Drugs? Pills? Supplements? What do you buy? All right, in legal terms, it's called consideration. You exchange money for service. All right, what's changing hands? That's called consideration. What does the consumer get? A bottle or surgery, or in this case, best face, top health, and quality of life. That's worth paying money for, and that's worth studying to deliver. So here's a big difference. All right, dentists, as we know it traditionally, bend over a patient to do the work in the mouth. Well, this thing called airway mouth doctors works this way instead. Okay, that's me. That's my patient. You can almost see this patient smiling there because the drill is on our appliance outside the mouth, not on her teeth. Okay. So one of the things that we do is that we pay attention to breathing. Airway starts in the nose. And guess what your nose deals with every day? Pollens. Okay. Last week was the end of the cherry blossom season. And guess what? Pollens. Okay. This is what your respiratory system has to deal with. And who is taking care of children's respiratory system? ENT, allergist, pediatricians? I don't think so. If that's the case, we would not have so many adults with this kind of face on the left, or this one you see here. This is the result of a runaway overdevelopment because of nasal obstruction, and the body is compensating for nasal obstruction. Okay. This is an an extreme case, of course. The kid is cavity free, but she looks and feels like a monster. She's very self-conscious about it. Okay. So it's really important that the dentists who want to look after their patients in the holistic and health caring sense, look after these factors here. Okay. One of my favorite views is look at a kid in from just below the chin. Look up. You can see if one eyebrow is higher than the other, one nostril is more flare, and one nostril is more angle inward. One eye is higher, one ear is higher, the lips trapped, the teeth are spacey, which is not necessarily a bad thing, but generally you can see that this head is off kilter. And this kid would not feel well. He might get bullied in school. He might not like school. He may not have much of a social life. It's all because the dentist only sees teeth and the dentist doesn't see the kid. Well, it's time we change that, okay? So instead of this, we can have this. Isn't that much happier outcome? This is my granddaughter, okay? At age 3 on the left and age 4 on the right. Full of life, right? There is actually a secret to that, okay? My son, when he called me up and said, hey, Dad, you're going to be a grandpa, said to ask the next question in the next breath. How do I bring out my kid's best face and top health? I said, well, that deserves a serious conversation, and that's what this one is about, okay? I want to tell it to you now. After doing this for going close to 20 years now, it's not any appliance. It's whole health, diet, and lifestyle. You got to see the red flags early. You got to have the right doctor guiding you. And you have to have the right value as a parent, okay? If the insurance doesn't cover, should you let your kid end up like this? This is a jaw surgery case, okay? So we now have a new playbook. The new playbook helps proactive parents grow best face, wide airway that will promote deep sleep and deep learning. We also can help proactive parents grow physiologically sound oral behavior. So what does that mean? It means you have sound eating habits. You have good taste for health. So it all began with this kid, 17-year-old. She came to me because she ground through her night guard. Look at her. What does her face tell you? She's tired. Well, she came to me on the left 4 years after braces, and she had ground through her night guard. Well, 3 years after I did my method, this is what she looks like. So it's the same person for sure, but a way better version. Why? Because we grew her airway 2.3x in minimal cross-sectional area and 3.1x in total volume. That means her body is getting a whole lot more oxygen, so's her brain, so's her eyes, so's every part of her. So on the left, she got orthodontics in when her genes were stunted in their expression. Here, we brought her gene to full expression or fuller expression. Only God could be saying that we get you to fullest expression. All right, so here's the formula. we combine the expander appliances with a bone building diet. Best of the plant kingdom with green smoothies, and best of the animal kingdom with bone broth. So one is the change in oral environment on the left with the expanders, and on the right is changes in oral behavior. All right, oral behavior also includes swallowing and lip seal, okay? So this young lady's anterior open bite is the result of tongue thrust. Well, why is she tongue thrusting? Once you figure out the root cause, I tell her you can change your face for the better. And indeed you can. Want to portray an idiot, just, stare at somebody with their mouth apart, lips open, okay? This is the work of Dr. Weston A. Price. He, I believe, is the original oral systemic dentist, 1920s in Cleveland. He was a smart cookie, went to Harvard, came back, father had a huge practice, and said, welcome to our practice. All the kids are yours now. And he looked, it didn't take him 1 week before he realized, geez, how come every kid had crowded teeth? He said, there must be some humans who don't have cavities, don't have gum disease, and have straight teeth, naturally. So he took a camera and went around the world, and sure enough, he found them. So these are called Price's natives, and they exist in all corners of the world. This is what I tell my patients. That's my end goal for you. Room for all the teeth to line up straight in your mouth, space in between the two jaws for your tongue so that your airway remains wide open when you sleep. And when that happens, you're going to wake up full of energy. You're going to have radiant facial glow, and you're going to have good mood and high energy. Regardless of your skin color, regardless of your ethnic heritage, I believe every tooth is entitled to its own plot of bone around each tooth. So otherwise, God wouldn't plant it there. Now, if the God planted there, conversely, there needs to be a plot of bone around it. So this is Dr. Price's research findings in the field, and Sally Fallon, who is the president of Weston A. Price Foundation, gave a great summary about how teeth tell the tale. If you have wide dental arches, you'll end up with straight teeth, and everything in your body from the head on down will work well on the left. Conversely, if you have narrow dental arches, you'll end up with crooked, crowded teeth, and everything in your head and on down, including difficulty childbirth due to oval pelvic opening instead of round pelvic opening, you're going to have difficulty, okay? So this is, the purple bone is the maxilla. I tell the parents, corner of the eye, corner of the mouth, ear to ear. Middle third of your face is this purple bone maxilla. That includes the cheekbone. Okay, so that's what gives somebody the great looks. But the underside of the great look is the palate and the maxillary arch. Well, you can grow this in a guided way to bring on best gene expression. So Zion had her braces stopped right here once the mother find out about this, and 2 years later, she looks like this on the right. And her airway grew 98%. Okay, and that's why she looks so wonderful. She didn't get 4 years of scholarship for the college of her choice because of her good looks. She got a scholarship because her school performance was fueled by this airway and sleep. So I maintain that the mouth is to humans what roots are to plants. Whether you're children or adult, male or female, you grow from your mouth. And actually your mouth is involved in whole body health more than just eating, drinking, and talking. It's involved in physiology. It's called alignment, breathing, circulation, digestion, energy, and sleep. The mouth supplies energy to the rest of the vital organs. All right. When the mouth is impaired, the airway is choked. When the mouth is impaired, the whole body is distorted. So look at this kid. The pelvis is distorted. Her left foot is pronated. That means it's collapsed inward. And if you look inside her mouth, well, it's got a disaster in terms of crowding and in terms of how upper lower jaw comes together. So what do? Well, you put an expander on. You teach the parents how to feed the kids. You teach the kids what they should eat. And if they follow, they will end up in good shape. Look at her tilted head. It's straightened when she went from left column to middle column and right. Okay. So if you look at her lower front teeth on the upper right corner, compared to middle right, they straighten. When that happens, guess what? The head straightens. If you don't pick that up when the child was young, then the kid grows up to be a regular in a chiropractor's office. So there are two kinds of dentists now, right? One kind drill and fill and to fix teeth. And I don't have any problem with that because you still need healthy teeth in order to do this airway mouth doctor's work, okay? But who's going to fix pain and fatigue, teeth grinding, anxiety, depression, brain fog, snoring, grumpy, irritable, right? Who's going to fix crowded teeth without braces? Who's going to grow best looking face? Well, it would be airway mouth doctor. Okay, so that's what my patients say to me. I wish my dentist could do this for me, all right? So airway mouth doctor is a new breed of dentist who is trained in figuring out where the mouth is impaired structurally and then treat that impairment with painless epigenetic method, which I'll show you right after, well, soon. All right. So first thing you got to do is know that what the body needs from the mouth and what the mouth needs from the body. This kid came to me right at the end of the pandemic. Mother didn't take her to a dentist for 3 years. And she had a traffic jam. Old teeth have not fallen out, new teeth are coming in, and this is her airway. Look at that perfect hourglass choke zone right there. So the color scale goes from white to green to orange to black. All right. White and blue is wide open. Green and yellow is so-so. Red and black, you're in big trouble. 4-lane highway versus half a lane. So does she have too many teeth or does she have too little jaw? You make the wrong call and the patient suffers for the rest of their life, okay? So this is the most important, the most consequential sleep research, in my opinion, for us airway dentists and mothers who want to grow best face and top health for their children. Sleep apnea in kids is a disorder of oral facial growth. All right, so the research jury is in. Oral facial growth is where it's at, if you want to stop. snoring, sleep apnea, grumpiness, depression, anxiety, the whole thing. You got to stop this from happening. Okay, so get the jaw to grow. Instead, what's happening? They took out teeth, okay? So here's a case one of my students sent to me and said, well, the teeth are still crowded after teeth were pulled for braces. What's your next move, doc or mom? Do you agree to that? I mean, the teeth are still crowded. Are you going to pull more teeth? Why did God put teeth in your kid's mouth? Well, this is a very courageous orthodontist from Britain. These are twins. One had teeth pulled for braces, the other one did not. You decide which face you prefer. I know which one my granddaughter is not going to have. But the good news now is we're able to bring this girl who reached out to me during the height of the pandemic and said, oh, my jaw hurt so bad, I want to kill myself. Can you help me? Well, I never laid hand on her, okay? I recruited her dentist in the western edge of Australia, literally the other side of this earth. And in 12 months, we put her from the brink of suicide. Because we can regrow jaws now, and therefore we can regrow the airway. So here's another patient who had teeth pulled, a TMJ problem, has choked airway, and she just ended up at age 66 with breast cancer diagnosis. Did healthcare work for her? And if not, where did it go wrong? And that's because this idea called impaired mouth is brand new to all the dentists in the world. I coined this term, impaired mouth syndrome. A syndrome is a collection of symptoms related to a condition, right? So if your airway is choked, you're going to have lots of medical, dental, and mental, emotional symptoms. So here's a child who came in. Look at this, lips apart, chapped, chin's weak, airways choked, teeth are crowded. They're crowded even after teeth were pulled for braces. Where the red arrows are, there should be 2 of those in each quadrant. Like you see here on the lower. There are 2. She only has 1, and she still had crowded teeth. She wakes up tired 7 days a week. Focus is a struggle. So the dental work got done without regard to the patient's mental, medical, emotional health, social well-being, okay? Well, we did our work, and here's that 6 months later. All right, Mr. D, may I record this for teaching purposes?
Yes.
Thank you. So you have a breakthrough news to share. In response to my question, how has Lucy changed? Right?
Right. Very interesting. Here this last week, she washed the dishes for her mother without being asked.
Huh?
Yes.
That's a first?
Yes.
Wow. That is really impressive.
It is.
Yeah. On her own, huh?
On her own.
Okay. And in what other ways have you noticed?
Well, as she matures, I see that she is becoming much sweeter. The smiles are
Much
coming.
sweeter.
Yes.
Yes. And the smiles coming together, right?
Yes.
And she started this Start Thriving appliance for how long now?
I think we're at about 6 months, if I'm not mistaken.
That's very good. Thank you for sharing your experience with us.
You're welcome.
So you can see that daddy's happy, right? And I'm happy because the child is blossoming or starting to blossom. So what you'll find is that grumpy people, their mood will get better once their sleep is better. And that sleep gets better because the jaw is growing, because the airway is widening. This is my mentor, Dr. Rich Beisel. Bless his heart. He passed away last year. He drilled into my eyelid. You cannot diagnose what you don't know. All right. Our dentists are not sufficiently educated to connect mind, body, mouth, and whole body health. So dia means opposite, differentiate, diametrically opposed. Nose means to know. You have to know the right from wrong, left from right, correct from incorrect, physiology from harm. If you don't know that, you can't fix anything. And I taking his point a little further and say, airway mouth doctor can transform healthcare, faces, and lives through airway, sleep, and jaw growth. So this is Lucy, the one who did the dishes without being asked. Okay. We can figure out why her chin is weak, why her airway is choked, because her jaws are too narrow. This is after extraction. This is after braces. Do you think that the doctor started out knowing what he or she was doing? What Lucy has is a 6-foot tiger now in a 2-foot cage instead of 3. 3 is average. Her home office for the tongue just got made smaller from extractions. Now, not every kid is as lucky as Lucy, because Lucy's dad said, hey, my daughter is starting to have some of the symptoms I have, and I have sleep apnea. She's too young for that. Well, here's a boy whose dad said, if insurance doesn't cover, it must not be important. And yet he has all these problems: obesity, allergy, teeth grinding, dark circle under the eye, poor school performance. He's killing his teeth with teeth grinding. He's got oversized tongue, okay? But insurance doesn't cover, not important. You can't help people like that. So here's the essentials on how to grow airway and best face. You have to have absence of 4 original sins. That would be tongue tie, nasal obstruction, low thyroid, and gut inflammation, and toxic chemicals and pollutants. Okay? We live in a toxic environment. I'll show you a few pictures, a few slides later on. So absence of 4 original sins is a must. And then you have to establish physiological norms. That means physiology is to how the body works. Lip seal, you have to swallow normally. You cannot swallow with a gurgle. You cannot swallow with a gooseneck. Okay? You got to have fresh home cooking. I'm sorry, Mom. You want kids with great airway and best face? DoorDash and drive-through is not going to do it. You have to feed the kids a bone-building diet if you want them to grow and if you want their face to glow. You got to do A and B first and then assist with appliance if needed. Okay? So let's look at the nose. So the airway passes through the nostrils. It enters the body through the nasal passage and then goes behind the soft palate, goes behind the tongue, and then onto the trachea. Well, this zone that we look into, when you open your mouth, look in the bathroom mirror, and open your mouth, is zone 4. That's where the dentists operate. In order for the upper airway to work, okay, the A in AMD stands for airway. You got to make sure the nose works. Here's how to assess. I want you to pay attention to this area here and here. See if it collapses.
Can you just breathe through your nose for me?
Lips
Good.
together.
Now
Lips
block one
together.
nostril like you did earlier. Inhale strongly. Good.
So we're
Thank you.
listening for
Thinking the other way,
obstructions.
please. Good. Now let go. And I want you to snort very quickly, like this. Again.
See the collapse
Harder.
there? Yeah.
Thank you.
Her left side is way more obstructed. That's why it collapses there. It's a very easy test. Non-invasive, completely comfortable. And it allows you to look inside as if you had a CT scan. All right. So there is a way to heal this without drugs and surgery. This is sinus membrane swelling. They went away because the jaw grew wider and the soft tissue swelling here shrank from eating the right diet. One more time in case you missed it. Pay attention. Can you see my cursor? It's right where this play button is. It's right on either side here. Take a look.
So inhale.
Look at the collapse there.
Good. Thank you.
Listen to the obstructive sound.
Your lips closed and inhale like you're snorting.
Yeah.
Thank you.
So without a CT scanner, you can tell that there's very little black to serve as airway corridor for the air to enter the nose and into the body. Why is that? It's because the kid did not eat healthy. You cannot eat anything that's out there for cheap, all right? I'm not saying you had to eat expensive food, but I'm saying you had to select your food as if they had the potential of blocking your nose and causing you health troubles. Look at these lips here. One look, you know, the kid needs some guidance, okay? And zoom out a little bit, you can see that he's got breakouts on his skin, all right? 3 months later, look at this. Here is a super compliant mom and kid. As soon as I provide them with a little bit of guidance, they implement it 100%. Look at the improvement, okay? The body wants to get well. So if you want to be able to breathe through your nose, there's no substitute. You got to eat healthy. And I don't mean you got to eat cardboard food. I mean you have to eat food that doesn't cause your nose to get swollen, okay? So there's a way to test instead of guess. I'm founder of this place called KBMO Diagnostics. It's a kit that they'll mail to your door. Finger stick, 5 drops of blood, put it on a paper pad and mail it in. 2 weeks later, you'll get a report. This is mine, okay? This is Felix Liao right here. Guess what I was sensitive to? The red list is egg white and egg yolk. Who would have thought, okay? Egg white and egg yolk is causing my nose to become swollen and my gut to be swollen. All right, the next one is pineapple and sorghum. Well, I don't drink beer, but I eat pineapple. These are healthy foods. You don't know until you test, okay? So they'll provide you with a report on what to eat, what to, pay attention to. I don't have that many, but the ones that are bad for me, I eat often, okay? So, and if you have a sweet tooth, they'll figure out that you have candida and what to do. And they give you a recommendation on how to eat an anti-candida diet. And this is how you get better, Okay. So again, absence of four original sins, presence of normal physiology, got to be established first before you do appliances. If you just do appliance and ignore all this, it'll all fail as soon as you take the appliance away. Why? Because we live in a super toxic world. There's pharmaceutical in your tap water, according to U.S. Geological Survey. By extension, restaurants serve you tap water. I don't see any brand name coffee shop serving filter water to go with the coffee they sell you, okay? Chicken. When I go out, I do not order chicken unless I know where it's sourced from. This is where xenobiotics and hormones got introduced into veterinary medicine and animal raising, okay? The incredible story of how antibiotics created modern agriculture and changed the way the world eats. Is it gluten or glyphosate? Stephanie Seneff is an astrophysicist, PhD, who devoted herself to tracking glyphosate toxicity. It matches perfectly with celiac disease. I mean, you cannot get a better correlation than this. The real reason wheat is toxic in the United States, it's not because of the gluten, it's because of the glyphosate. Weed killer found in a wide range of breakfast foods aimed at children. This is Guardian and Great Britain. This is Environmental Work Group, Children's Health Initiative. Breakfast with a dose of Roundup. All the oat-based cereals, they've got glyphosate in there now, okay? Some of you with biological dentistry practices, you'll have patients who are sensitive to gluten. They go to Europe, they can eat bread, no problem. They come to the States, they have all kinds of problems. And the difference is that US allows almost 6 times more glyphosate in our food than Europe, 0.3 to 1.75. It's good for allergists, good for drugstores, not so good for your kids. So you're welcome to do this experiment. I did it on myself. Here's an organic bakery, brioche bun. I put it out on the porch along with this tomato. 5 days. The mold in the air attacked this tomato, but not the brioche bun. Why do you think that is? There's something toxic in the brioche bun. Okay? The mold knows. All right. So bone building diet, obviously you want to grow the jaws, you got to have bone building diet, right? So this is turkey soup that you take out of the fridge after the morning after Thanksgiving. Okay? And this is seafood stir fry. Simple. And it'll do all kinds of good things. Fix snoring. It would reduce nasal obstruction. You'll get beautiful hair and skin. You get children that looks radiant. Never mind woman's own, right? So here is a handful of arugula, tomato, half a banana, and organic chocolate powder. Put it in the blender. 15 seconds later, you got something yummy that even kids can do. So why don't I put salad there? Because kids don't eat salad, but they'll drink green smoothies if you get it right. People say, well, what's your recipe? Well, here's a handful of arugula, half a peach, avocado, a little seasonal fruit, in this case, blueberries, and chocolate powder if you want it. This thing is good for your blood sugar. Okay, so these are glucose monitors. You want it to be 100, below 100. So you drink this, it'll actually lower it. This is from the pandemic. We will not measure your temperature, we'll measure your weight instead. Because everybody staying home is eating too much. And so everybody's gaining weight. Just because commercials push a certain food at you doesn't mean you have to say yes. In fact, you had to guard them as if there were toxins. And you can choose to do this instead. This is my son, Chef Franklin's recipe. Avocado toast on sourdough and grilled salmon on leeks. Very simple, easy to make. Just a matter of planning and taking time. If you don't make food fresh at home, I'm sorry, you're gonna be loaded with fixatives and preservatives and plasticizers and food coloring. And that's what led to what's called underlying conditions or pre-existing conditions that kill most of the COVID patients, okay? Why did some patients go into ER and ICU and don't come out? They have underlying conditions, okay? And so this one was done by Chinese CDC in February of 2020. And this is confirmed by US CDC that 89% of US hospitalized for COVID March 1 to 30th during the year 2020 have these underlying conditions. Hypertension, 50%. Obesity, just about 50%. Chronic lung disease, diabetes, and cardiovascular disease. You think anything has changed? No. Why? Because they push vaccine instead of treating underlying conditions. And what happens with underlying conditions? Obesity is associated with alterations in immunity. If you're obese, you'll have a chronic low-grade inflammation. So you're going to be prone to inflammatory cytokines, and cytokine storm is what kills people during COVID. So this is a way out. This is the way to fix the foundational illness. This is how you put every patient back together. So let's take that to the patients, youngsters. Okay, so well, I've been doing this for 15, 20 years now. And look at this kid. He went from here to here and from here to here, no braces. Eating healthy and practicing what we show the parents. They're great kids, family of 7. I'll show you 2 of them. So we always do our homework to figure out what's off where and how much, and design our appliance to target what's off. And when jaw grows, teeth will line up straight naturally. It's that simple. Head straightens. You know, high school girls, they'll know who the winner is. You gotta read a book. Another one. This is his sister. Okay, top left, counterclockwise to top right. 6-year span. We can control the emergence of beauty, of health, of radiance. Appliances and assist. The absence of original sins from the environment, from hypothyroidism, from food that's been tampered with, is paramount. And then you have to eat healthy. It's a joy to be whole every time they come in. We don't have fights. We have compliments and joy. I told her she could become a lipstick commercial model because she did such a great job. The same 3D jaw diagnostics allows us to treat or co-treat scoliosis. Okay. You went from top left, counterclockwise, to top right in 3 years. Okay. He came to me after he had finished braces and after he had been under a chiropractor's care for for scoliosis. What made a difference is that we fixed them out so that a chiropractor could fix the scoliosis. I asked him to wear the same t-shirt 2 years later. Perfect evidence, okay? So this is what I can tell you. 80% of health troubles, whether it's in kids or adults, starts in the mouth, and AMDs can fix them out. And when we do, medical, dental, and mental, emotional health goes away. Okay, last case. On top left, she was already a good student. All right. Mom said, hey, I think she's got crowded teeth now. I want to get ahead of her problem. So when we grew her only this much, she won all these prizes in school without, guess what? Having to try very hard. And look at those lips, okay? So this is nothing but joy. When you create health, you'll have joy. You had to identify what's off where and how much. Her upper jaws were way too small for her lower jaw. Okay, so what? Well, so you're going to have neck problems. You're going to have postural problems. You're going to have bite problems. So if you identify what's off, do our thing. Look at how this jaw has grown by the gap that you see here in the appliances. And look at how this has changed. Even the deep overbite got better naturally. Never any braces. This is a close-up look of her progress. So this is 12 months, 24 months. Look at how they blossom under the right conditions. Okay, you want to grow a victory garden? And it's the same principle. You want to grow victory kids. So we have cracked the epigenetic code in a nutshell. We know how to grow kids toward health, best face, and peak performance. So drill and field dentistry, in my mind, is dark ages dentistry. It doesn't mean it's wrong. It just means that we're chasing after fires. We're not getting ahead of the fires. We're putting out fires. Whoops, I got a typo here. Here, everything we do is painless. Okay, the changes are made by the parents implementing the changes. The changes are not performed by the doctors. Those of you who have braces, you can tell. It's the orthodontist that arrange the teeth, not you. Here, how you grow your face and your jaw according to my guidance is what gets you the results. I love this case. She was very touchy. She was sensory challenged. Our parents wasn't sure if she could tolerate this. The whole family, our patients of mine, she was the last to come. I was shocked when she said this to me, so I recorded it.
We have Adelaide here who's got a message to share, but first, Daddy, may I record this for teaching purposes?
Yes.
Thank you. So Adelaide, tell me, what message do you have for other kids? You wear your appliance how many times a day? How many hours a day?
I never take them off unless if I'm eating or if I'm cleaning them.
Really? And how do you manage to do that?
I just keep them on and that way I don't have tenderness in the morning.
Oh, okay. That's a smart strategy. Thank you for sharing your experience with us.
Look at the life in her eyes, right? Yeah. So those of you who are dentists, you can actualize all your patients' full potential by becoming an A&D, learn how to do this. Just scan this QR code and you can fulfill her wish. Those of you who are not dentists in the audience, you can expect a couple emails tomorrow and the day after. And also you'll hear about our next webinar a week from now, I believe, on adults' pain and fatigue, okay? So sneak peek, we're gonna cover adults, how this same principle could be brought about to basically change life quality, not just face, life quality, because the airway gets better. And in the process, become proactive on killer diseases. All right, so that's it for tonight. Thank you very much for attending. I appreciate your interest, and I am happy to entertain any questions if you care to unmute yourself. Anyone?
Dr. Liao,
Sure.
I recently saw a young girl about 3 years old,
Ah,
and the mother brought her in and says she cannot breathe while she's sleeping.
yes.
And she had already had her tonsils removed.
Yeah.
So how do you handle a case like that? Because she's too young for any appliance treatment. I talked to her a little bit about a diet.
Yeah.
Um,
So mother needs serious education and guidance. Mothers needs instructions from doctors who care, right? And so mothers needs guidance on this,
okay.
okay? So check out her tongue tie, sometimes releasing the tongue tie and getting a food sensitivity testing done will go a long way, okay? If the mother is hypothyroid, the kids are very likely hypothyroid. And find out what they eat for breakfast, lunch, and dinner, and snacks. I'm willing to bet that there will be areas for improvement. I had a kid who had grand mal epilepsy. I asked the mother, what do you feed the kid? So we want the kid to be healthy and clean, so we only feed him vegetables. I thought, wow, the brain is 80% fat. How about giving him some sardines and eggs? Well, in 3 months, we got him off all anti-seizure medication. Sometimes it's as simple as that. So you kind of have to look at the kid holistically. It's not the appliance, like I said, it's always the physiology. That is the logic that the body follows. All right, so 2 years
you.
old is young, but it also means that it's physiology that's at fault, not the teeth. And it's usually the environment.
Okay, thank you.
Yep, welcome. Anyone else? Well, going once, going twice. Otherwise, I'll see you next week on adults, aches and pains and fatigue.
All right. Thank you so much, Felix, for doing this. And let me know when you've got the recording ready, because I know that there were a lot of people who wanted to attend, but it was in conflict with whatever they were already doing. So
problem.
hopefully,
Yeah, sure,
hopefully more will be able to come next week too.
sure, no problem. And, Denise will forward the recording to you tomorrow.
All right. Thank you so much.
Okay.
All right. Night, everybody.